Today, I'm going to talk about how demographics and diversity changes in healthcare leadership, especially in B and C suite, have shifted over the last several decades, and what that means for performance expectations, policy influence, and social responsibility in healthcare organizations. I'll walk you through historical changes, how those shifts changed what we expect from leaders, and how modern leadership strategies connect to equity, community engagement, and professional involvement. When you look back 50 to 100 years, healthcare leadership has almost entirely been white, male, and very hierarchical. Olden talks about how those rigid structures limited advancement for women and minorities. As someone who works in healthcare, I can tell you leadership diversity truly matters. When leadership all comes from one background, it affects how decisions are made and who gets opportunities. Over time, the workforce diversified, and that pushed organizations to rethink who belongs in leadership. Dye points out that diversity isn't just a nice to have, but it's an actual strategic asset. But even today, American College of Healthcare Executives, known as ACHE, shows minorities are still underrepresented in senior roles. We see this in hospitals, the front line is diverse, but the executive table does not necessarily reflect that. As leadership became more diverse, expectations expanded. Leaders aren't just managing operations anymore, they're expected to address equity, cultural competence, workforce diversity, and community engagement. In my hospital, I feel this shift. Leaders are expected to understand the communities that we serve and support staff from the backgrounds. ACHE found that organizations with diverse leadership teams are more likely to implement equity-focused policies and respond to community needs. When leadership reflects the population, policies tend to be a little more inclusive, whether that's staffing, patient experience, or access to care. Today's leadership strategies really build on these demographic changes. CSR, or corporate social responsibility, which is a leadership approach where healthcare organizations commit to acting ethically, supporting community well-being, and operating in ways that build public trust. In healthcare, CSR often shows up through community outreach, transparency, environmental responsibility, and efforts to improve patient experience and equity. This helps build trust with patients and communities. Just culture supports psychological safety, something we rely heavily in my hospital on for reporting errors and near misses on our high reliability organization journey. Sustainability requires long-term inclusive thinking. These strategies only work when leadership is diverse and connected to the community. Healthcare organizations have shifted from rigid hierarchies to more team-based models. That opens more pathways for diverse leaders to grow. In my own experience, team-based structures create more opportunities for nurses like me to step into leadership roles. When leadership is diverse, it improves community trust, cultural alignment, and access to care. Patients feel seen, staff feel supported, and CHE, the National Association of Health Services and Executives, and Institute for Diversity and Health Equity are professional healthcare leadership organizations that focus on developing diverse, equity-minded executives. NAHSE supports advancement of Black healthcare leaders, and IFDHE, co-founded by the ACHE, promotes diversity and health equity across healthcare organizations. Together, they strengthen leadership pipelines through mentorship, education, and advocacy. DI emphasizes how important these groups are for building leadership pipelines, especially the people who haven't historically had access to those opportunities. Grassroots advocacy brings community voices forward, while lobbying influences legislation and funding. As leaders, we need to understand both. Diverse leaders often have stronger ties to community needs groups, which helps align organizational decisions with real community needs. When you put it all together, demographic changes, expanded expectations, stronger policy influence, and modern leadership strategies, you can see the clear pattern. Diverse leadership strengthens equity, social responsibility, and community health. In closing, leadership diversity has reshaped healthcare. Modern leaders are expected to champion equity, safety, and sustainability, as discussed earlier, and professional involvement helps us grow into these roles. As someone working in a community hospital, I see every day how important it is for leadership to reflect the community we serve. Continued progress is essential for equitable access and better outcomes. Thank you.